Become routine now. Wear a mask, practice social distancing, avoid large gatherings, and wash your hands.
Now, those are simple steps that we can all take to prevent the spread of COVID-19, but unfortunately, it seems that not everyone is listening.
Jay Sethi is the director of the UW Health Population Health Institute and can give us a better look at this pandemic from the view of a public health official. Jay, welcome to Live at 4.
Good to see you.
Thank you for having me, Mark.
We've been hearing the message for over 8 months now, same thing over and over, but yet not everyone complies. It must be frustrating.
Yeah, I mean, it is frustrating. We've known from the beginning how to stop the spread of COVID. The messages have been consistent, but unfortunately, people's following those mitigation steps, has been varying. And right now, we need people to, follow mitigation like never before.
Well, we've heard some encouraging news about vaccines, and that is something that we can all be extremely thankful for. But that doesn't mean we should give up on what we're doing right now, right?
That's right. I mean, the news has been encouraging, and the Food and Drug Administration is now going to be looking at data to see if it's safe and effective. And when the vaccine comes, it's not going to be an overnight process. It's going to take months for the vaccine to be rolled out in communities. And we've seen from COVID spread right now, it just takes a few weeks to have a skyrocketing number of cases, hospitalizations, and deaths.
Do we have any idea how the vaccines will be distributed?
Well, it's going to be a process, and federal officials and people at the state and in the community are going to work out a system to figure out who are the first receivers of the vaccine and how long that will take. It also is going to depend on how many doses are going to be received and how quickly the vaccine can be brought to the public.
So if frontline healthcare workers, for example, are vaccinated first, is there any way to estimate, even a ballpark estimate, of when the general public might expect to get vaccinated?
Yeah, and from what I'm hearing, it's not going to be soon. I mean, we're definitely talking 2021, maybe even by summer 2021, maybe even beyond. But this is it's hard to know. First, we have to look at the data that the FDA is examining, find out how safe, how effective, and sort of what their timeline is for releasing the vaccine. Until we get the green light from the federal government, it's really hard to know what's going to happen here in Wisconsin.
So obviously we cannot let our guard down. What kinds of public health policy needs to happen right now?
Well, there already are policies, but not everybody's following them. They're at the county level, they're at the state level. People need to stay at home, avoid all gatherings, wear a mask whenever you go out. Of course, wash your hands. That's always important. And doing those very basic things, they're cheap, they're good solutions, and they do stop the spread of COVID.
Do you think if we do those simple things, we can turn this thing around in the time while we're waiting for the vaccine to arrive, that we have the ability to stop the spread of this now?
Yeah, I mean, we have to. And we demonstrated as a state that we could do that back in April when we had the first safe-at-home order. People began staying at home before the order took into effect, and the curve, so to speak, was flattened. We have to now flatten the curve again, and it was done before, and we can do it again.
And the holidays are coming at the most inopportune time.
Well, this is the time of year where people do travel, unfortunately. In an ordinary year, that's great. It's good to celebrate the holidays with loved ones. This year is different, and this is a time when you spend time with people outside your household, lots of opportunity for different bugs to spread. And COVID is clearly very deadly, very infectious, and it's not a good time for us to be surging right now.
So let's wear a mask, social distance, small gatherings, wash your hands.
That's right.
And Jay, thanks for being with us today.
Thanks to you at Public Health for all you do for all of us every day.
Absolutely.
That's right. Today's Public Health Thank You Day. So definitely shout out to everybody in the public health workforce.
Have a safe and happy Thanksgiving.
You too. Thank you.